Wounding from a firearm. Character of firearm wound depend largely on the distance from which the shot is fired. Many books describe this distant shots are contact, close contact, near contact, close near short, intermediate, long range, except for contact wound, which indicates muscle and touching the victim. Such terms have no standard definition. Effect of distance on a firearm wound shows the ejection of a flame, smoke, unburned powder (FSP) particle. That is, flame, smoke, unburned powder particles from the gun, such just as it is fired. Flame travels the shortest distance. Smoke goes farther. Unburned powder particle go farthest. Farthest. Okay. Effect of distance from firearm wound, that are burning, singeing, blackening. Blackening causes by smoke. SB. Smoking. Smoke causes blackening. Flame causes burning and singeing. Tattooing are caused at a different. Tattooing is called unburned powder, bullet shooting head. Flame causes burning, searing, scorching, and singeing. Burning is used in relation to skin and singeing in relation to hair. Burning relation to skin, singeing relation to hair. In the hair, keratin melts due to excessive heat and then resolidifies on cooling, produces a clubbed round shaped at the tip. Another phenomenon is seen due to keratin melting and resolidifying in crocodile skin in electrocution. Searing and scorching are area of intense burning, typically seen in near contact wound. Searing and scorching are areas of intense burning, typically in near contact wound. Darkening and parchmentimization of burned area occur after due to drying. Darkening and parchmentization of burned area occurs after death due to drying. Smoke produced by complete combustion of gunpowder. Complete SP, that is complete combustion of gunpowder, responsible for blackening, fouling, smudging. Primer residues also do not enter the skin and produce blackening. Smoke simply deposit on the skin without actually entering inside the dermis, only in epidermis. Okay. So smoke particles, burned powder are lighter, deposited on surface, can be washed away. Appearance normally black, but if a powder is a smokeless grayish or whitish deposit, how to detect? Take a wet cottage sauce, sponge or towel and try cleaning the wound. Blackening would vanish. Cotton would be blackened. Infrared photography detects blackening on both skin and clothing. In bone, lead may be rubbed off from the bullet, which may look like a soot. Test for metal would be negative in a true blackening. True blackening test for metal would be negative. സോ ഇതിൻ്റെ അകത്ത് എപ്പിഡെർമിസിൽ അഫക്റ്റഡ് ആവുന്നത് ബേൺഡ് പൗഡർ, സ്മോക്ക് പാർട്ടിക്കിൾസ് ആർ ലൈറ്റ്, ഓൺലി ഡെപ്പോസിറ്റ് സർഫസ് ക്യാൻ ബി വാഷ്ഡ് അവേ. ബട്ട് ഇൻ എപ്പിഡെർമിസിലേക്ക് അൺബേൺഡ് ഗൺ പൗഡർ ആണ്, അത് ഡെർമിസിലേക്ക് പോകും, ഗെറ്റ്സ് ടാറ്റൂഡ് വിത്തിൻ ദ സ്കിൻ, cannot be washed away. Instances where smoke can cause tattooing and irremovable. In hard contact and near contact wound. In hard contact and near contact wound, mechanism soot is baked into the skin due to intense heat. Pseudo blackening. Pseudo soot looks like blackening, but it's due to causes other than the smoke. Causes: powdered asphalt, bullet first striking asphalt road and carrying asphalt with it. Fingerprinting dusting powder, graphite, powdered lead. Person carrying this substance in pocket, a bullet first striking them and then entering body. Subcutaneous hemorrhage, drying of edges of gunshot wound gives a blackish appearance. Miscellaneous point: spread of smoke as well as unburned powder is considerably affected by length of the barrel of a firearm. A gun with a 5 cm barrel will spread smoke and unburned powder over a much larger area than a weapon having a 15 cm barrel fired from the same distance and using the same of ammunition. As the distance between muzzle and target increases, Area of blackening and tattooing at the target increases. Density of particle deposition decreases. Unburned powder. Unburned powder produced by incomplete combustion of gunpowder, which has a consistency of a very fine sand, responsible for tattooing, also known as a stippling. Another stippling, basophily stippling of RBC seen in a lead poisoning. Peppering, since it appears as if a black pepper has been spread around the wound. Some authors prefer to use the word tattooing when it is on living subject. Other terms were used when seen on inanimate object. Unburned powder particles have such a kinetic energy that they actually penetrate the dermis and come to lie under it. In decorative tattooing, the artist actually drives the pigment particle inside the dermis with the help of an electrical gadget. Since the unburned particles are similarly driven inside the skin, process has been termed tattooing. Appearances. Multiple punctuate aberration, seen as a dark brown dots individual tattoo point surrounding the wound. Individual tattoo points are surrounded by a small magenta colored zone of micro contusion caused by the trauma of high speed impaction of a powdered grain with the rupture of the small blood vessels. How to detect? Take a wet cottage gauze, sponge or towel. Try cleaning of the wound. Tattooing wound would not vanish. But blackening ലാണെങ്കിൽ അത് വാഷ് ചെയ്ത് പോകും. Cotton would not be blackened, can be identified under a hand lens or dissecting microscope, picked up for analysis by little probing, and even ignited with a red hot wire for confirmation. Note: all gunpowder particles reach dermis. Some get deposited on the skin and embedded in the punctuate aberration caused by it. It is this which can be burned with a hot wire or even washed away. Infrared photography dictates tattooing on both the skin and clothing. Measurement. Tattooing must be measured in all directions around the wound. Tangential wound produces unequal tattooing. Also burning, singeing, blackening around the wound. 3.60. Although the presence of gunpowder means intermediate range. The diameter of this pattern can help to further narrow down the range of fire. Both the soot and stippling are most concentrated immediately around the gunshot wound, and a decrease in concentration away from the wound. Increase in range of fire will increase the area of stippling, but their density decreases. When fired at a right angle, tattooing is distributed equally around the entry wound. In angled wound, tattooing is more on one side compared with the 3 points, which shows a small distribution with respect to aberration color. Range. If tattooing is visible, wound is termed as an intermediate range gunshot wound. Miscellaneous point. Palms and soles are very resistant to powder tattooing. Thick skin resist entry of powder, gives important range. Only 3 need to be remembered. Rest are multiples of that across the cells. Flame causes FSP in the flame, burning, scorching, singeing. Looking at a singed hair around the wound. Smoke, blackening. Wipe the wound with a wet sponge. Blackening vanishes, sponge becomes dirty. Unburned powder particles tattooing, wiping the wound with a wet sponge. Tattooing does not vanish, sponge remains unclear. A simple mnemonic to remember very commonly accepted range of burning, blackening, and in various forms is pistol and revolver. Pistol and revolver 3, 6, 12 to 18. That is multiplication. That burning 3 ആണെങ്കിൽ blackening 6, tattooing. Burning എന്ന് പറയുന്നത് മറ്റേ flame, blackening smoke, tattooing എന്ന് പറഞ്ഞാൽ unburned powder. റൈഫിളിലാണെങ്കിൽ 6, 12, 24 to 36. ഷോർട്ട് ഗണ്ണാണ് 12, 24, 40, 82, 72. മൾട്ടിപ്ലിക്കേഷൻ 2 into 3 ആണ്. Pseudo tattooing. Pseudo powder tattooing looks like a powder tattooing, but it is due to causes other than powder. Causes: short gun filler, bullet passed through a sheet of glass before hitting the victim. Stippling produced by fragment of glasses. Gas stippling. Such as stippling tend to be scanty, larger and regular, with a greater variation in size compared to powder tattooing. Glass fragments are usually found embedded in the skin and adhere to clothing. Examination of recovered bullet with a dissecting microscope may reveal minute fragment of glass embedded into the tip. High velocity bullet fragment after striking glass. Stippling made due to minute fragment of bullet. Its core and metal jacket in addition to glass. Ricochet bullet. If bullet ricochet of a hard surface, cement, granite, stone, wood, minute fragment of this surface may fly back and produce stippling. Fragments of plastic casing enclosing shot in a handgun shot cartridge, steel wool, packing material, crude silencer. On firing, fragments of this material is propelled out and embeds itself around the wound. Postmortem insect activity. Lesions are larger, more irregular, and have a dry yellow color, arranged in a linear pattern indicating the feeding path of insects. Gunshot wound on hair area, hemorrhage in hair follicle. Pathologist shave of hair to examine entrance wound. Hemorrhages in a hair follicle may look like tattooing. Suture removed from a firearm wound. Needle prick, puncture mark, interpreted as powder tattoo mark. Petechiae found during hospitalization if tight tourniquet was put around the wound for the same reason. Thank you.